said before, mobility can come from the joint itself or it can come from the muscles. So right now I'm just getting a little distraction on my hip as I bring it terminally into flexion. I can do it with in a neutral position. I can do it with a little bit of some internal rotation right there. And then I can post it on my leg, get into figure four so I get some distraction with a little bit of external rotation right there. This is really good for people with some hip pain, hip impingement as well, or who just has some tight hips and is lacking some mobility there. And the other one is here, where we come from the side, and I allow distraction from the side of my hip joint. This is called lateral distraction to the hip joint right there, and I can do it in a more neutral position. I can do it with some internal rotation right there. And then I can also cross my leg in front and do it with some external rotation right there. I could go full pigeon and oscillate right there if I'm really trying to target the glute, or if I'm trying to more target the posterior capsule of the hip, I can lock that figure four right there, drop to my forearms, cut an angle, and then just let that band take my hip out to the side right there. Another way you could also do the distraction with some hip flexion here is, again, get it on the upper third of the thigh, hands and knees, and then just rock back. As you rock back, you're starting to bring your hip into terminal flexion while still applying a good glide on it and a distractive force on it.